Howdy, folks. I'm Bob Shaw, physical therapist.
Brad Heineck, physical
and
therapist.
together we're the most famous physical therapists on the internet.
In our opinion, of course, Bob.
So this is the second video in a series of videos we're doing. Are you a shaker, compressor, extender, or flexor? Your back pain.
Right. So these are 4 classifications of how back presents itself with pain, and then how you treat it. And you took information from Dr. McGill.
Dr. McGill,
and
right.
then you kind of made it so that hopefully it's more understandable to
right.
the layperson.
Hopefully.
Yes.
So we already talked about, are you a flexor and extender? Most of you will be one of those. But these are less common, but they do happen. So are you a shaker or are you a compressor? Let's first talk about shaker. A shaker is a term we use for somebody who has spinal instability. So this model is, I think, the best model I've ever seen on this.
So we're talking about typically in the low back,
Right.
the lumbar area.
So the spine is no longer held together like it should be. It's not a tight and proper fit. Now, in this spine, the problem is actually a disc. It's got a bulging disc that's got weakened.
Right.
And
So these are the vertebrae in the low back at the
Yep.
belt line. And if you look at these lines we put on here so you can reference, this disc is stable, this is stable,
You're
but
right.
you'll notice this one is weak. And go
look,
ahead.
look at first these two,
Yep.
these two bones.
Right there.
And I go back and forth like this. These bones stay lined up because there's great stability there yet.
Right.
Now, this one, where the bulging disc is, see how the line moves to the left and right
Yep.
of the other line.
So when you twist your body,
You get micro movements.
right, and that may create pain,
yes.
because of that instability.
Right. So these are the questions you ask. Does your back ever feel like it's giving out? Like it's
So those quick, ow,
Right.
really sharp pain, and then it kind of gets
you
better
might get
quickly.
spasms along with that.
Yep.
Do you feel like catching or locking in your back when you're rolling in bed?
Right, that's a common one.
Yep. Or twisting your back.
Yes.
It makes you very scared to do
Right.
anything. Because,
So what happens is the muscles in that area will contract to stabilize the back, and that can create
Right.
that chronic muscle tightness or
Yep.
pain.
Yep. And then you become afraid to do anything.
Yeah, it's
So again, it's common also with transitional movements, especially again, rolling in bed is
Yep.
one of the major ones.
Yep.
So when you're rolling in bed, one thing that is kind of a test, Brad, that we do.
Sure.
I'm going to show it real quick.
yep.
If you don't
I'm going to
mind.
get out of your way.
When you're rolling in bed, you're going like this, you're twisting your body a bit. But one thing that we want you to try, and we've tried with our patients, is actually try rolling first normally, and you might get pain. A lot of my patients did. But if you tighten up your stomach, you actually can put your fingers into your abdomen, and you can feel that you tightened, and keep it tight the entire time. You're bracing your back, and it actually should feel better.
And in the therapy world, therapists commonly call this log rolling because you try and tighten your core up so that when you roll, this doesn't happen. Everything goes
Rolls
together
together.
like a log. So therapists use that a lot.
All right. Are you a compressor? Now, this one is not very common. Surprisingly enough, my son actually is a compressor.
Okay.
And he got it from lifting heavy weights, and he does it. He actually, when he has his back in extension, that's when he feels it.
So when he arches.
Yeah, when he arches too much.
Yeah, I see.
He's got an anterior pelvic tilt. So again, Brad, if you want, the test would be to sit in a chair, and you can compress the spine. You can do it the 3 different ways. Again, you can have the back in the C position,
Rounded.
and then press. He's pulling up on the chair,
Yep.
which creates compression,
Yep.
and then
And
straight.
see how that hurts.
Yep.
And this gets a little confusing because it is similar to
To
some of the other
flexor,
tests.
right.
So if that hurts, and then if I go in good posture, pull again, and that will hurt or not hurt.
It may feel better. Most people, I think it's going to feel better.
If you're a compressor, though,
Even then, it'll
Okay.
probably feel better.
and then if we
Extended.
extend that way,
That often hurts because you're getting pushed onto the smaller joints
Sure.
of the back.
Yep, the facets.
Yep.
Yep.
So another test, this actually was positive on my son. You take your weight like this and you flex your back, extend your back, and straighten your back. And it felt fine with him when he did that.
Yep.
But when he went like this and he extended his back,
Yeah.
because he didn't like to have the extra force. The long lever arm puts increased pressure on your back. He normally would have pain with squatting or deadlifting, something like that.
Yep.
But he found out once he kept his back straight and didn't extend it, he no longer had pain.
And then he would tighten his core up.
Right, tight,
stabilize.
exactly. So it's kind of a funny one, compression. And I like you said, it might be one that you're already a flexor. And the compression doesn't feel good, but I one of the category for people who seem to have only when they lift heavy weights. They have pain. So
yeah, normally things feel pretty good, but when you lift a heavy weight, it's
right. If you want to see the other video on flexor and extender, go to bobandbrad.com, go to the program section. And we have a free program there on back pain.
Sure.
And if you watch it, you pick out the ones you want to watch, the videos.
Yep.
And along with that,
a PDF printout showing pictures of the exercises as well as a review of the whole video so you can look at it. And it's absolutely free. No email, not a thing. It's just a wonderful.
It's because we love you.
Yes.
Yeah. All right.
But we don't love each other.
No.